Okay. Good morning, good afternoon, and good evening, everyone. I welcome you all to the 2054th day of uninterrupted daily webinar of IFPH. Let's start our session with our silent prayer. Thank you all. Our today's guest is Dr. Sadath Sait, BHMS. He is a director and chief consultant of Dr. Sait Homeopathy, Cochin, Alva. He is having more than 35 years of clinical experience and he worked as an official in various homeopathic associations in Kerala, one of the most wanted faculty in Kerala. Now, he is here to present on the topic of scope of biochemical medicines in homeopathy. Once again, we welcome you, Dr. Sadath Sait, and the mic is yours. You can start your session, doctor. You can take up to 45 to 50 minutes for your session.
Okay, thank you so much. Doctor, may I know your good name?
Dr. Sweda.
Okay. Thank you, Dr. Shweta, for the lovely introduction. It's been a long time after that. I have not come to English session. Okay. Today, what we are planning to do is let's restudy whatever the 12 tissue remedies. I'm planning to take one by one so that we go into the depth of the knowledge. How does this biochemical or tissue remedies acts in our body? What is 12 tissue remedies? How does that act? What is the composition? How it can affect you? It can help you out in your daily practice, right? Okay, we have been dealing with all the materia medicas, everything, but this 12 tissue remedies somehow it's been ignored or sidelined by homeopaths. Okay, including me. One second. Let me share. Okay.
Okay.
Can you see?
Yes, doctor.
Okay. Okay. Till 12 tissue remedies and homeopathy. Okay, that's our topic. Okay, let's just give a brief on what is 12 tissue remedies. Okay, the 12 tissue remedies are by Schussler's. That is, he is the founder of this tissue remedies, also known as biochemic tablets or biochemic cell salts. Are 12 tissue mineral salts considered fundamental for the cellular health. One second. Okay. Is this better now? Slides? Can you hear me? Okay. We have the 12 tissue remedies, the 12 mineral salts considered fundamental for cellular health. Developed by our Heinrich Schussler. This system of homeopathy suggests that the dietitian's deficiencies in mineral, in salts, in other things can cause a problem in our health. So how do we correct it? What are the medicines required? How do we select the medicines? What are the in-depth knowledge about the tissue remedies? Okay, that's what we have to find out. So calcarea fluor, calcarea phos, calcarea sulf, ferrum phos, calcium mure, caliphos. Okay, potassium sulfate, kalium sulfate, mag mure, mag phos, natron phos, natron sulf, silesia. Okay, these are the 12 tissue remedies. I'll repeat once more. Silesia, natron sulf, natron phos, natron mure, mag phos, kali sulf, calcarea fluor, calcarea phos, calcarea sulf, ferrum phos, kali mure, and caliphos. Okay, so let's start with one by one. We will go for the calcarea fluor, or calcarea fluor is or calcium fluoride. So let's start with calcium fluoride. What is a calcium fluoride? Or what is calcarea? What is the homeopathic calcarea is and how do we take it? Okay, calcarea refers to the class of marine sponges. So what is that called? Marine sponges, phylum Porifera. Okay, this is calcarea, what we derive for homeopathic prescription, for homeopathic manufacturing or homeopathic medicine manufacturing. Okay, distinguished by the spicules, skeletal elements. Calcarea is found in the marine sponges. That means it is soft. It is just a skeleton. Okay, it is made of spicules. Spicules is, you know, that it is pointed. Uh, what is it called? Pointed chalk-like sticks, small sticks. Okay, unlike made from calcium carbonate. Unlike other sponges like silica plus spicules, it also refers to homeopathic medicines derived from calcium-rich substances like oyster shells. So calcarea carb, calcarea is made from oyster shells. Okay, or bones. That when it is taken from the bones, it's called calcarea phos. If it is from the oyster shells or sponges, marine sponges, it is calcarea carb. Okay, that is the difference. Okay, what is spicules? The defining feature is that they are spicules which are calcium carbonate. Okay, calcite or aragonite. That is another name of this. Calcite or spicules is that that needle-like thing rather than silica. So it is, silica is different, calcarea phos is different, and this is completely spicules are made of calcarea carb or calcium. Okay, spicule shapes, it comes in a different shapes. Okay, why I'm telling all this is that too important in homeopathy? Yes. The morphology of the medicine or morphology or the procurement or what is the look, constitution, how does that calcarea looks like, that is more important when it comes to the basic character of the medicine. That is why I am going little more deeper, so that we know what is calcarea carb and what is calcarea fluor. Okay, they commonly have a 3-point. So defining feature of this. Okay, they commonly have a 3-pointed triactin. Triactin, it's a 3-pointed spicules. But 2 or 4 also can happen. But usually, calcarea, what we take it for homeopathy with 3 spicules. Okay, body forms. They're the only sponges with simple asconoid and syconoid body plan, though more complex. Look at this is the formation. There are 3-4 formations. Lichenoid is other, that is more complex forms of calcium spicules. Okay, ascanoids, that is another name given for this with simple form of shape of the calcarea which we see, sponges. Okay, habitat, where does it come? Predominantly shallow marine environment, though some deep sea species exist, but it is in a shallow, not too deep seas. That is where our homeopathic or manufacturing or calcarea carb exist. Okay, we take it from the marine source, but not in the shallow or very deep ones. We take it from the shallow places. Shallow places may be next nearby or something next to the trees or anything of that sort. It can happen next to the trees. Okay, how does this look like? That is also more important, right? So water flows. It is made of pores. One that's this marine calcarea or spicules we see, it has developed from the spores. It has a lot of pores, so that the marine water gets in and goes through. It doesn't stay. Understood? If it does stay, it will get spoiled. It comes in as a marine, this one. It absorbs nutrients, whatever required for this to sustain, and water flows off because of the pores on the body. Okay. Captured by specialized cells and water exists. So the nutrients, when the water or marine water gets into it, the nutrients are collected from the specialized nutrients are captured by the specialized cells called ostia. Okay, and water exists through the exits. Water flows away through the larger openings. Okay, and more the adult forms of this calcarea or the adult sponges or the calcarea from where we take it are almost a sedentary living attached to the surfaces. So you know what we have learned from the Materia Medica, or we have learned from the first year of what is calcarea. See, it is just getting collaborated. So everything is from the root. We have to get through this root. We have to know this root. We have to learn from this. So calcarea character comes from this stationary, living, sedentary life, which is attached to the surface through larvae. Okay, though the larvae are free swimming, once the larvae forms this, it becomes sedentary and attached ones. Okay, are you following me? Is it easy? Am I making it little more easier for you, or it is little tough?
Yes, doctor, it is fine. Okay.
Is okay, no? I'm not going
Yes,
faster
doctor.
also, because these are the
No, it's
basic.
enough, doctor.
These are the basic things we until unless we don't understand what is calcarea floor, why is it this way, we won't understand. Okay, simple structure. They are multicellular but lack of complex systems. Nervous, digestive, circulatory, everything is there because it's a living organism. Okay, and have unspecialized cells that can change functions. We have a specialized also to absorb nutrients, and there's unspecialized cells also that can change the functions every time. And the best thing is porous bodies. Their bodies are filled with the canals and pores, giving them their name porifera or pore bearer or holes. It is soft, it is very lighter with pores so that the water passes away. Okay, it doesn't stand. Why is this important? I will I will explain it to you. Okay. Skeletons. They possess internal skeletons made of minerals, spicules, and protein fibers. It is called spongin for the support. Okay, protein is there, skeletal is there, mineral, this one, so that it gives a tougher, it looks like a tougher outside shell. Okay, calcareas are always thought about as a tougher. They are big, huge, flabby. Once we look into them, it's something heavy or strong. So that makes a look like a stronger one, but it is very porous and it can go faster. Okay. Okay, they have existed for long time, 100 years, more than we live. So whatever is there, it has existed for a long time. Okay, diverse forms. Okay, they come in countless shapes, branching, vast-like, interesting rope-like, vibrant colors, reds, blues, yellows. Okay, so these corals or this sponges comes in a different forms. Calcarea rubrum, calcarea, different colors. Once it is colors are coming. Okay, major groups include Demospongiae, most diverse, hexactylida, glass sponges. It looks like a glass. Calcareous sponges, and Hemoscleromorpha. So different forms, different varieties exist. Okay. Marine dominance. Most live in oceans, from shallow reef to deep trenches, with a few freshwater species also. Ecosystem important. They play a vital role in the reef systems. they cannot survive other than this ecosystem. So marine ecosystem and freshwater forms are there, but if they change it into marine, they die. Same here, if they live in the marine, they cannot go into the freshwater. So ecosystem is very important. Human uses and treats. Historically used for bathing. These coral reefs, we take it, slowly we use it into bathing because of the pores and softness. Bathing, cleaning, padding armor, even we use it for the scrubbing of the feet. Right? We use it for manicure, pedicure, or otherwise cleaning also. Okay? Currently faces threats from pollutions. Okay, in homeopathy. Now we'll come to the homeopathic use and homeopathic. What does it used? How it is used? All that will come into the calcarea floor group. So calcarea floor is a portion is calcarea plus fluoride. I'm talking about calcarea portion. Once the fluoride is added into it, the character of what is existing more will be shown in prominence. That is why calcarea floor. Okay. So homeopathy, the calcarea group derived from calcium compound, most notably calcarea carbonate from oyster shells. Considered a major constitutional medicine representing human needs for stability, security, and protection. Why the calcarea carb is given? Calcarea carb we usually give to the patient which doesn't have a security kind. They are always fearful. What Kent has written is fear. Calcarea means fear, anxiety. Okay, that is the first and foremost letter written by the Kent. Am I right? Okay, human needs for stability because they are very, very, very laxed. They're very lazy. They don't work. They are just ideal protection. They want someone to protect them always. They doesn't want it to go alone. Fear. Core theme revolves around the need to be for a safe shell. Calcarea needs to be protected. Calcarea always in a shell. Okay, and a secure home, income, health. They cannot be put into the risk. Calcarea, Calcarea cannot take any risk, even financially, even at family. They want everything peaceful. They cannot work. They cannot move. They cannot take tensions. They cannot be confused. They cannot do any work. That is calcarea, right? So they want everything ready-made. They want everything peaceful. They cannot take any small tensions. They are just ideal creatures. Okay? Calcarea individuals fear anything that jeopardizes their safety, including leading to deep-seated insecurity, anxiety. Slight change in their environment, slight change in their in their routines, slight anxiety, slight fight in the home, someone shouts at them, that everything makes them anxious and fearful. Desire for orders and routines. They want everything in routine. They cannot change the routine. That is the basic feature of and calcarea is another one. Is calcarea loves dependence. Calcarea floor, calcarea loves strong attachment because elderly ones are attached to the shores or onto the roof or somewhere it just gets attached. That is what is seen in the calcarea character also. They are more dependent. They are strong attachment to the people who provide a sense of protection. They are more attached to the parent. They are more attached to the mother. They are more attached if they are grandfather or the father and mother scolding, they will go to the grandfather or grandmother. They get cling to the grandmother. If she is not scolding them, grandmother is the best for them. Okay, they don't. They go to the people whom who they protect. They say, okay, this girl is good. Don't shout at her. Don't scream. Don't do anything. Don't make her work. Don't make her. Don't scold. So that girl or boy is very attached to them, not with the others who teaches the proper ones. Go change your clothes. No. If your grandmother or someone in the family says, don't change now, why are you shouting at the kid? He will change. Then the baby is pet of the person who tells that. Okay? Chalky complexion, cold perspiration, especially on the head, and is generally chilly. Okay, murrain, salt, heat. They wanted a shade. They always wanted a shade. They always wanted a cold place. So they are always chilly. They wanted something very cold. Heat is intolerable to them. So they always calcarea carb is a chili. That is what we said. Why the chili? Why the chili? They are not in the deep water. Deep water is little more colder than the shallow water. When the shallow water is little cold, they go into the shades. They always want some cold place. They always wanted a cold climates. Okay, slow development. Everything is slow. Used for children with the delayed. Everything you know, frontal is everything. So it's a delayed. It comes from the doctrine of signature. We all studied what is doctrine of signature. This is doctrine of signature. Okay, and in Palsatla we have learned that Palsatla wants a stronger rooted place, but the stems they just keep changing. Palsatla wanted someone um, close by. Same thing in Calcarea also. Metabolism and nutrition. They have low cellular metabolism and often suffer from poor nutrition. Vitamin D, calcium deficiency, bones are brittle, osteoporosis more, joint, this one is the spondylitis is more. Okay, they have low cellular metabolism because of this stagnant. They don't want to go and have their food. They don't want to change. Everything comes easily because marine water comes easily and throws out from easily. Okay, weak, brittle bones. See this everything. It is doctrine of signature. We say the sources of collection, sources of the plant, sources of the medicines. That makes things different, easier to understand. Design aversions, intense craving for eggs because calcium is more. Sweets, again, salt, mineral water. Not mineral water, I'm talking about marine water. Indigestible things, chalk. Dirt, pencils, aversion to fat, meat, milk. This explains the source of calcarea. This explains how homeopathic calcarea carb is made of, from the where the source is. So, see, you can correlate and you can talk to, you can find out what is calcarea and how the source is. Okay. Aggravation, symptom worsen in cold, damp weather from physical and mental exhaustion. Again, simply explained. Improvement from resting and warm. Simple. Calcarea carb attached. Simple sitting together. If the patient is better with the sitting or attached, patient doesn't move from one place to another. Okay, if we call, if we tell the kids to switch off the TV and go to study, he has to move. He is not bothered about the studies. He cannot take mental exertions. He is ideal where it is. He is not able to work. He is not interested in working. Okay. And now, daily calcium requirement is range from 1000 to 1300 milligram for most of the adult, generally increasing to 1200 for women over 50 and adults over 70. Okay, this is the basic requirement of calcium. So you will be wondering, if this is the daily requirement, what will be our calcarea floor will do? Calcarea floor, one tablet, how much? I will explain it to you. Okay. So this is the daily requirement of a calcium. I'll tell you, children 1 to 3, 700 milligram. Children 4 to 8, 1000 milligram. Adolescents, 9 to 18 years, 1000 milligram. Adults, 19 to 50,000. Okay, woman, pregnant, breastfeeding teens, breastfeeding adults, 1300. This is available everywhere. I'll just give you this. Okay, now what if the we cross the upper limits? I'll just go through. Okay, the maximum safe daily intake is from food is generally 2000 to 2500 supplements. That is what we have to make sure that calcium supplement has to be in a limited range. You cannot just keep changing the calcium supplements. Keep increasing it. And one thing is make very sure is, without vitamin D and proper vitamin D in the body, calcium absorption is not possible. 90% of the calcium absorption happens when there is adequate vitamin D is available in the body. So we have to check, if we are checking out the calcium, we have to check the vitamin D also. Nowadays, vitamin D is problems are very rampant. Okay, especially in Muslim community, in my community. Why is that? Because they wear parda, they don't expose to the sun. At least other people are like they expose their hand, at least their legs or some part of the body is exposed, neck or something of that sort. But in Muslims, they wear burqa and no part of it is exposed. And they so that becomes very difficult for the Muslim community. So if it is Muslim community, if you find the deficiency, especially in Muslim community, if they are wearing burqa, check for the vitamin D and calcium. Okay, dietary sources. Best source includes milk, cheese, yogurt, calcium fortified food like juice, cereals, and soy milk. Okay, broccoli and bony fish, sardines. We say that sardines are the smaller fishes. Okay, supplementations, and if dietary is insufficient, supplement is needed, but it's consult the doctor with before, or they should not take it just like that. So we should advise them, monitor the calcium intake, then go for it. Okay. And you must be wondering, we are talking about the tissue remedies. I am talking about calcium supplementation. Why? I'll tell you. Okay, calcium overdose typically results in from excessive supplementation leading to symptoms like nausea, vomiting, constipation, abdominal pain, increased thirst, frequent urination, muscle weakness, and confusions. Okay, this is typically calcaria. If a patient comes with nausea, if the patient is under calcium supplement, get the calcium level checked. Small informations, but it will be very useful in your clinical practice. We are clinicians. Okay, research work, they have the research work, they will do it. We are clinician, we should understand every symptom. The patient complains about your nausea, vomiting, constipations. If the patient comes with the constipation, get the calcium level checked. If especially if that person is taking iron tablets or calcium tablets or anything, old age people, 90% that comes with calcium intake. Calcium Santos. Previously, it was a calcium Santos which used to take. Okay, so get that done. Patient come with cramps in the legs or hands or anything other, get calcium checked before giving medicines. We can give symptomatic medicines. Along with that, check this. See, homeopathy is not just symptomatic treatment. Homeopathy is a holistic treatment. We consider everything. Diagnosis, we consider the whole of a person. So these things also is required for our medicine to act faster and in a better way. Until unless if we correct the what are called what kind of a symptom it is called, uh, until unless we existing symptoms or not existing symptom, uh, causative symptoms. If we don't correct the causative symptoms, however the medicines we give it, it is not going to affect you as we expected. So both has to be there. So take the case in a proper way. If the patient comes with this, we have to see whether the patient is taking a calcium intake or they have any other complaints of old age, that mobility of the bowels are less. If you find a calcium intake over the period, then you will have to check calcium. Even if they don't take it, that time also we'll have to check the calcium. Especially in elderly. Serious complication of kidney stones. Kidney stones, we have to check the calcium levels. If the patient is complaining of serious renal complaints and renal stones, renal failure, cardiac arrhythmias, and potential cardiovascular risk. Okay? So don't think that cardiac complaints will not come to you. Don't ever think that cardiac complaints won't come to you. Cardiac complaint does come to you, and in a frequent and rampant way nowadays. Okay? Digestive issues, constipation, nausea, abdominal pain, loss of appetite, kidney. Okay, neurological. I'm not going into too much into symptoms. Muscular system problems, muscular weakness, twitches, all that. Kidney stones, damage, high calcium leads to kidneys, heart issues, irregular heart rhythms, and cardiac arrest can go in extreme cases. That is in extreme cases. Okay. Okay. Supplement overdose, taking more than the recommended daily allowance and cause issues, medical conditions, actionable advice. If you experience symptoms, seek medical advice. Means we have to give, not send them to allopathic doctor or someone. We have to assess the patient. We have to tell them this is the condition. If it is extreme arrhythmias or something of that sort, then refer it to a cardiac center. If you cannot control, or if you can not if you don't have the proper infrastructures. Okay. Now deficiencies triggers severe widespread health issues, primarily affecting bone density, muscle function, and nerve signaling. Key symptoms including, see, all this is written in Materia Medicas, Calcarea. If you read tissue remedies, or you go into the Calcarea, Bore, Kent, any medicines. You go to the this one synthesis repertory. You go to the Materia Medica. These symptoms have been written in Calcarea. Okay, fractures are common, right? These are the simple symptoms. Always we get it. Okay. Bone dental health, chronic deficiency, all that you know, heart and circulation, low calcium can lead to irregular heart rhythms. So again, if it is high also, low also. That is why checking calcium levels are more important in a cardiac patient. Muscular and neurological issues, tetany, spasm, stiffness. Okay, diabetic patient comes with stiffness more, frequent stiffness. Diabetic patient comes with stiffness or tetany or cramps. Go check your calcium levels and vitamin, because in diabetes these two can go down. Okay, so go get a checked. Anxiety, low depression, In all these cases, calcium checking of calcium is more important and more important and more important, most important. So get all this is checked. Skin, hair, nails. Individuals may experience dry skin, eczema, hair locks, brittle, easily broken nails if there is deficiency. Okay, so where all this can act, you understood. General fatigue. Okay, general fatigue. Get the thyroid checked if there is a general fatigue. Nutritional deficiencies, lack of dietary calcium are more common. Medical conditions, I told you. Demographic, increased risk of elderly adults. And postmenopausal women. Postmenopausal women, why the calcium is less, I don't have to explain it to you. Increase in intake, okay. Supplements as recommended by the healthcare provider. That means we. Okay. Now comes what is tissue remedy. How does this act? Okay. See, 1 grain tablet. Usually calcarea floor or any what are called any biochemic salt comes in 1 grain. 1 grain tablet. So 1 grain tablets approximately 65 milligram of homeopathic tablet of calcarea fluor or calcium fluoride. I'll come to fluoride section later. Okay. The actual amount of calcium and fluoride in that is too negligible. So where is 1000? Where is 1000 milligram? 1300 milligram, and where is one tablet of 65 milligram or 1 grain tablet of calcarea fluor? How does that help you? Does that mean that we have to take 10, 15, 20, 30 tablets a day? Still, it will not be 1000 milligram, 1300 milligram. Okay, understood? Then why do you have to go for the biochem? Okay, actual amount of calcium and fluoride is negligible. Homeopathic tablets are low potency. So again, calcarea fluoride crude is not that 1x, 3x, 2x, 3x. So we again triturate. Triturate means the crude forms are getting negligible still. If it is in that case, why should we give calcarea fluor? Right? It is a common doubt. Anyone can get it. If you go and explain it to a customer or patient or customer or whoever, why should we take calcarea fluor? Why should we go for any of the tissue remedies? What is the importance in tissue remedies? Tissue remedies in the body. Okay. Okay, these are the potencies. 6x means active calcarea fluor contains calcium fluoride triturated with lactose, intended to act as a catalyst. Okay. Now, how does this affect? 1 grain of calcarea fluor 3x or any tissue remedies, how does this act? It helps if it is a minute dose also. It helps. It acts as a catalyst or our body to what I call it makes the body to work. What does homeopathic medicine do? Homeopathic medicine works with our vital force or our innate energy or innate immunity. It improves the quality of our immunity and it takes care of the disease. That is what any medicine and homeopathy does. Same way, this promotes in the cellular level. This acts as a catalyst and utilize calcium rather than providing a nutritional dose of calcium. So whatever the calcium is there, whatever the cells that is getting digested, whatever the action of a calcium, it happens in the body, or if the cells produce or cells utilize it, it pumps or it energizes, it channels, it acts as a catalyst so that the supplement or anything or body to produce more calcium. Understood? It promotes. So what is the use of calcium? Calcium fluoride. How does we use? We can use not just as a medicine or not just as a tissue remedy. This can be used for any elderly person. So my way of treating is not just therapeutic only. We can use as a nutritional supplement also. Right? Every day you take two tablets, 2 times a day, once a tablet or one or two tablets daily. What does it do is it catalyst or it helps absorb the calcium more from different sources. If you take the dietary intake, it helps the body to absorb calcium. That is why calcium fluoride or calcium or any tissue remedy is used for. Okay. So my ways you can give to any patient after 40 or 50 or after menopause. You don't have to bother about patient having symptoms. If the patient doesn't have symptoms, if the patient, we know that okay, after menopause the osteoporosis will be more. So start giving this medicine so that the body itself does something instead of supplementing in a huge quantity. Let the nature, let the body do that instead of we give it as a synthetic. Understood? So this is the best and the action of tissue remedies. I'm not talking about calcarea floor as a medicine. Therapeutics different. Okay, tissue remedies, what does that do it? Tissue remedies can be used in or any medicine for calcarea floor. We have seen it as a medicine also. We have seen it as in a lower potencies also. How does that we give it as when we have these symptoms? If it doesn't have any symptoms also, we can supplement because 1 grain has just minute. So we overdose of calcarea floor doesn't happen here, right? That is the best thing of homeopathic calcarea floor. So any patient comes with this small symptoms or after menopause or anything of that sort, osteoporosis, and then keep supplementing it. You can give it without any hesitation. If it is a bone derangement or anything of that, if you know that calcarea force can be given, calcarea floor can be given. Okay. This is the way I do it. Commonly referred to as calcarea floor, tissue salt of elasticity. Okay, this is more important. Calcarea floor is known in homeopathic, this one or anywhere, it is calcarea, a tissue salt of elasticity. Homeopathic remedies use support body structure, everything you know. Okay, again the same calcarea floor helps humans based on its primary uses. Okay, where all calcarea floor in a lower potencies can be used. That is 1x, 3x, 2x, 3x can be used. See, varicose veins. Elasticity, wherever the elasticity we lose it, calcarea floor comes in. I'm not saying that other medicines are not there, but calcarea floor is one of the best medicines, even in the hemorrhoids, even in varicose veins, even in varicose seal of the testis, aneurysms. Okay, hemorrhoids, aneurysms, bone and joint health, strengthening bones and teeth, joint stiffness, bone injury repair. So each and every word I said, this is important. Get into your brain so that calcarea floor, each time when this kind of a patient comes, you can think about calcarea floor, calcarea floor, calcarea floor. Okay. Skin health, restores elasticity. Again, skin conditions, dry, rough, scaly skin, cracked skin, where the elasticity is not gone. Psoriasis, cracked skin, cracks of the heels, hardened and tissue lumps. It helps in softening, reducing the size of the hard, stony and indurated gland. It is used in the fibroadenoma of the breast. It is used in the fibroma of the uterus, it is used in any kind of gland, lipoma, neurofibroma, or dermoid cyst, bony growths. Okay, anywhere can be used in this. Oral health, that is most important. Calcarea floor, Hecla lava, all the very good oral remedies. Key indication: complaints worst by rest, better by motion and warm applications. Why? Chilly patient, better by warmth. Okay, and better by motion, or we have to push. It's an ideal this one, but better by warmth. Calcarea fluoride action also coming in. Okay, forms available, most available, you know that. Safety, generally safe. Okay. So what will you say if there is a calcarea fluor has to be given is, should we supplement? If it is required, supplement, but in long-term supply with supplement with calcarea fluor, 1x3, 2x3, 3x biochemical salts, so that the intake of calcium supplement can come down. Okay, come down in a drastic way, and it can be body itself facilitates it. Chronic relaxation everywhere. Okay, calcarea is a chronic relaxant. All this I've told you: restoration of skin, dissolution of hardness, intervention. It is also known stony hard gland tumors. Calcarea carb is a destroyer or kill or flattens or resolves stony hard gland tumors, because calcarea floor itself is a spongy, soft skeletal of this one's coral sponges. Vascular skin connective tissue repair. Okay. Joint ligament tear. Any tear, any joint, we get this medial meniscus tear. Calcarea floor again, even if it is a what are called tendon tear, calcarea floor again repairs that. So calcarea floor is an inevitable medicine in these conditions. Okay. Now fluoride. I'll just go with the fluoride. I don't think that we have the time for natrum here to be explained. Okay, I'll go for a fluoride. Fluoride is a crust, or it is available in the salt, in the earth crust. So that is the cementing feature. Where do we get the fluorides are? What does a fluoride do? Okay, fluoride binds the calcarea and takes things into the body cells. They penetrate deep into the cells and strengthens the body, strengthens the minerals of the mineralization, stops preventing the mineralization. So from where the we get it is every earth crust has this fluoride. So how does it comes to into our body? Any what are called synthetic also, it is prepared naturally. We get it from the water sources. This, when the rain comes, it goes into the water resources. We drink it. And nowadays, usually toothpaste are fortified with this. Many of the food supplements are fortified with fluoride. Now, India also has stopped. Very few countries do that because of the fluoride increase. Once the increase happens, if the fluoride conditions are high or fluoride quantity is high, it damages the bone tissues. Okay, and why the in calcarea floor? Calcarea is calcarea floor, the combination of the calcarea or the calcarea factor is more than a fluoride. Fluoride is very negligible than the calcarea. That is why calcarea floor shows all the higher qualities of calcarea rather than the fluoride factor is very, very, very minimal. Okay, so tissue remedies with the calcarea fluoride has a minimal fluoride, so the action is more seen in calcarea of calcarea. Okay, should I continue with the natrum or can I stop it here?
Yes, we can continue.
It is hardly 5 more minutes left. So natrum is also again big process.
Otherwise, we can go for discussion.
We can go. I think we can go for discussion, and natrum and other tissue remedies can be discussed one by one. Okay. Okay, I'll just give you a brief of the natrum, or 2-3 minutes. Natrum again, tissue remedies, salt, right? And I have seen many cases of sodium, lower sodium can improve with natrum 3x. If you can get 1x, 2x, confusions, sodium once it comes down in the bedridden patients. It is once a bedridden patient comes in, sodium if it is less, blind, you can give 3x triturated and give it in a pills form. It will definitely improve. In 1 or 2 days, maximum in a 2 days, the sodium levels can come up. It depends if you wanted to make it more faster, 3 tablets, 3, 4, 5 times a day. That depending on the how less the sodium levels are. Okay, it helps improve the absorption of the sodium into the body. Okay, once if we ringer lactate or sodium, this one normal saline, if we give it, it improves the absorption of sodium. Okay, so this is my personal experience. I'm sharing it with you. Rest of the things I will explain it in the next class about the natrum. Natrum and all the other tissue one by one we will take it up. Can I stop here? Hello?
Yes, doctor.
Doctor.
Then we can move on to the discussion. Doctors, if you are having anything to share, you can turn on your mic and you can ask now. If you are having any doubts or anything to share, you can share now.
So I would suggest you is make this a habit or ask your patients to take tissue remedies in your routine way in your body. Okay, instead of we supplementing or we are waiting for the calcium to come down, start giving it in a regular way, one tablet, at least one tablet a day. If there is a diabetes patient, it can give 2 tablets a day, because that will help you improve the calcium deposit. The patient may not take might not have to take this calcium supplements in the future. 40s, you can start. 50s, make it compulsory.
Rampranesu sir, do you want to speak?
Thank you, Dr. Dhaneji, and congratulations, Dr. Sadath Sait, sir. Very nice, excellent session. Describe the tissue remedy. Large describe the calcium group. Calcarea phos, calcarea fluor. Calcium group is a very important remedy. Acts on bones, glands, and connective tissue, useful in growth disorders and weakness. So, calcarea phos, growth and development, and calcarea fluor, elasticity, hardness, body, calcarea sulfurs and skin infection is a very good remedy. Acts on deficiency, salt group, very important remedy, and used for deficiency. Very, very thanks, Dr. Sadath sir. Thank you, sir.
Thank you so much, sir.
Yes,
Abraham Vaidyan sir is there.
yes, want to speak? Dr. Abraham Vaidyan? Please unmute. No, wait.
I think, Doctor, it is almost time.
Okay.
Okay.
Shall we wind up the session? Okay.
Yes, yes, yes.
Thank you, Doctor. Thank you, Dr. Sadath, for your wonderful session. Really, it was very nice. You explained each remedies and the requirements, indications, everything you explained very well, and the session was very nice. Due to time shortage, we could not complete the session. We can meet in the next session with the continuation of this. Thank you, Doctor. Thank you once again. Thank you all. And I'm handing over the session to next doctor.
Yes, there is an announcement for tomorrow. Tomorrow we will have a session from Dr. Anil Khurana, the former national president of NCH and the former director of CCRH. So hope all of you will join us tomorrow at the same time. It's a very, very important day for us. Hope all of you will join. Thank you all.